area on which I think we could agree, and that's telehealth. Take a look at what's happened in the last 4 months. One of the most dramatic developments in the delivery of medical services ever, and why we should make some of the changes that were made permanent. I recently heard from a psychiatric nurse in Tennessee who's been seeing patients during the COVID-19 pandemic, which means she saw them over the internet or talked to them on the telephone. She told me of one of her elderly patients who, before the pandemic, got to her appointments by walking from her high-rise to Gallatin Road, catching a bus, and then walking from the bus stop to the clinic. Then when the patient got to the clinic, she had to wait for her appointment, and then when it was over, she had to do all that in reverse again and go home. This nurse said her patient was in tears out of appreciation. Because of telehealth, she could now have that appointment from her home. She had access to health care without the long journey. She could still receive her medications, and that several of her other elderly friends felt the same way. Because of COVID-19, the healthcare sector and federal and state governments have had 10 years of experience crammed into about 4 months. In 2016, according to the Centers for Disease Control, there were 884 million visits between doctors and patients. Almost all of them were in person. A telehealth visit was rare. During the last 4 months, that number of visits has virtually exploded. At Vanderbilt University, visits went from 10 a day to 2,000 a day. In 3 months, Vanderbilt has had 100,000 telehealth visits. Before COVID-19, approximately 13,000 Americans enrolled in traditional Medicare program received telehealth visits in a week. In the last week of April, that number was 1.7 million Americans. In total, over 9 million Americans received telehealth visits between mid-March and mid-June of those who were in traditional Medicare. That's also made a difference in mental health services in Nashville, which the presiding officer knows very well. Tennessee Centerstone, which provides treatment for mental health and substance disorder uses, said it is providing nearly 2,500 telehealth visits per day, and 30% more patients are keeping their appointments. We've taken away a lot of the reasons they say people don't follow through. And at Cincy and St. Thomas Health, Tim Adams, the CEO, says they have 9 hospitals in Middle Tennessee, 800 physicians. He predicts that 15 to 20% of all their systems of visits will be by telehealth. In other words, Mr. President, we were up toward 1 billion doctor-patient visits in a year, and with very few of them being telehealth, and we're about to get in a situation where several hundred million of them will be in telehealth. Now, Congress and the administration reacted well to that. They made some temporary changes, in-home virtual visits, telehealth for patients in rural areas and rural clinics, telehealth for physical therapists, speech-language pathologists, other providers, telehealth for many more services, including emergency department visits, and allowing Medicare hospice and home dialysis patients to start their case with a virtual visit. Now Congress is beginning to build on what we learned during the pandemic, and here are the 3 steps, and I'll summarize them and ask that my entire statement be printed in the record, if I may. Without objection. So here are the 3 steps that Congress could now take to build on what we did temporarily during the last 4 months, in summary. One is to pass the HEALS Act that was introduced by Republicans on Monday, which provides telehealth access to part-time and hourly employees and extends the administration's telehealth flexibilities and waivers through 2021, and the rural clinics and federally qualified healthcare centers provisions for 5 years. Step 2 would be to expand the CONNECT Act. And here I want to salute a group of bipartisan senators who, back in 2016, Senator Wicker, Senator Schatz, and others, saw the importance of telehealth and have introduced a number of provisions for expanding telehealth services. And then step 3 would be to pass the bill I'm introducing today, which would go further than either of those first 2 steps and would make permanent in-home visits and the rural telehealth access, and also make permanent the authority for the Secretary to make the changes that the Secretary has made over the last several months. My speech specifies what those provisions are. They came following a hearing in our Health Committee on which experts testified. This recommends what all of the experts said we ought to do. There were 31 temporary changes in the telehealth policy of the government. This makes many of them permanent. The best result for the American people would be for Congress to approve all three of these steps that I've described. The changes in the HEALS Act that was introduced Monday, the Connect Act for Health that many senators have worked on since 2016, and then the legislation I'm introducing today. I don't think we want to miss the opportunity to make permanent the lessons we've learned during this last 4 months about one of the most important and beneficial changes in the delivery of health care services ever. I thank the President. I yield the floor.